most pressing challenges for patients with VWD today is actually get to the diagnose early and on time, because as we know, von Willebrand disease is quite prevalent and symptomatic von Willebrand disease is quite frequent. However, only a fraction of these patients get diagnosed early, and all the bleeds are prevented properly. So I think that something that I envision to and I would like to see in the future is that we can actually get to diagnose earlier in our patients, and then we can offer proper care for these patients earlier in life. Okay. Some of the challenges that patients with von Willebrand disease can face are frequent bleeding episodes that can impair quality of life, even though they're not like life-threatening. There may be life-threatening bleeding episodes, but most frequently, in my experience, what we see in adult patients is bleeding episodes that make the life of the patient difficult in social situations or at work, with their spouse, with their children. And also, if you look at the results of the Wheel31 study, you can also see a similar pattern. What therapy can do for this patient is to provide a way for them to normalize hemostasis and reduce the frequency, the intensity of these bleeding episodes. And in terms of what the evidence from this study and this and other studies can do for us, for the community, both of treaters and the patients, can increase their confidence in the fact that proper therapy can actually reduce the frequency and intensity of these bleeding episodes and improve their quality of life. The conditions required to shift the paradigm of treatment from episodic to prophylaxis, as we've seen in the Wheel31 study, is mostly the education and the confidence, both from the treater perspective and the patient's perspective, that the therapy is worth the effort. Giving an intravenous infusion is not an easy thing for patients. It's time-consuming. Sometimes difficult to obtain secure the venous access. So I think that it's mostly a matter of educating our patients, showing the evidence, discussing with them the benefits, and come to a mutual agreement on what is the best care that we can provide for them, and what is the trade-off? What are they getting out of this effort that they have to put in to be regularly on an intravenous therapy? So the most important finding of the Wheel31 study, in my opinion, both for the physicians and for the patients, well, there are three main take-home messages, I think. One is the therapy with Wheelate, the prophylactic therapy with Wheelate, is effective in reducing all bleeds. The second is that the therapy can work for all the subtypes of von Willebrand disease. And the third one is that it can work across all age groups. The pediatrics as the adults, so adolescent, and the younger patients as the adults, they were all doing better when they switch from on-demand to prophylaxis. So I think these are the three key elements. So works in reducing all type of bleeds. It can reduce the bleeding for all type of von Willebrand disease, and can work for all age groups.